up on my phone.
Yeah, me too. I'm just glad that our audio isn't delayed.
Shows that we're live.
Okay, I don't see it yet.
I mean, I don't see it on my page. I just see it on the thing up there. It says live.
Yeah. All right, I'm getting ready to go live, Evie Bell. You can be on it and say hi to everybody. Let's see what it looks like. Don't see it anywhere. Oh, well, here. Okay, yeah, we are.
And where is it showing up for you?
I just have to scroll on our page until I see videos and it says live.
On our heart, oops.
Like on our Heartland.
There, it just showed up. There we are.
And I think if I click
Hi,
on
everyone.
it, and then I can share it.
We're getting everything ready. Trying a new thing today. Elizabeth and I doing our social distancing. Elizabeth's at home with Evie Bell right there. And I'm at my house. This is new for us to do Zoom to Facebook. So thanks for your patience as we're figuring stuff out.
I'm just sharing it to a bunch of groups to get the word out and see how that helps, if it does at all.
And we want to know how you're doing.
Hi.
How are you doing?
Good.
Yeah.
Yeah.
What's it like
Okay.
being at home all the time?
Boring.
Yeah.
Boring.
But what do you get to do today?
School.
Are you excited about school?
Don't know.
You don't know yet. Jury's out.
Oh no.
Okay, so I think we're doing this.
Well, it shows. I see it's on our page, so I think we're
Yep,
we're doing it.
It's happening. It's real life.
It's happening.
Okay, so you and I have had our own adventures this week.
Yes.
I'm sure that like any of our friends on Facebook are having things to talk about, but do you want to start? Do you want me to tell you about my adventure?
Why don't you tell us about your adventure, Elizabeth?
So at the Louder household, we've been sheltering in place since like the 14th. And luckily my husband can work from home. I've been really lucky that I can work from home and see clients. I'm in my home office now. And so we've been just like hunkered down. My husband's gone to the grocery store like twice, but besides that, we've been at home. It's been unreal. I haven't driven or anything. Wednesday, I had a doctor appointment that I had made like 5 months ago, and it was for a specialist, and I really needed to see them. And the morning of, they called and canceled. And they had been calling like and leaving messages every day since the previous Friday saying, if you have coronavirus, don't come. Like, duh. Or if you're sick, don't come. If you want to reschedule. And I'm like, no, I want to do this. I'm going to do this as long as you guys are open. I'm coming. So I was so like sad because they called and canceled, and I understood why they were canceling. But I also thought like, I went to bed last night, like priming myself to do this. You can't call and cancel now, you know?
Yeah.
So I'm sorry, maybe it was the morning before. And I'm like, I'm ready to do this. You guys haven't canceled it. I'm like pumped to go. I had found a ride because my eyes are going to get dilated. Priming myself to do this. You can't call and cancel. It's going to be like a 3-hour appointment. So I was like prepped to do this. And so anyway, so I called and I was kind of pitiful, but I was also like, I understand, you know, I respect whatever you guys have to do, but man, I've been waiting 5 months for this appointment, and I kind of just need the specialist to tell me, you know, like what they think. So they said they were able to like squeeze me in, but still stagger their patients. So that was the first time I had left the house, and I was way more unsettled about it than I thought I was going to be, just being in the world. It was weird.
Yeah.
you know, like just driving down the highway at rush hour with barely any cars, going
Mhm.
into the hospital. I don't know. I don't consider myself a germaphobe,
Mhm.
but I've really been, you know, very, very mindful of anything I touch. And so the 3-hour appointment went by quicker than I thought it was going to take, but I could not get home fast enough. I just wanted to be back in my safe house,
Mhm.
you know? So that was way harder than I thought it was going to be. You know, I didn't think it would be like easy or fun and I'd be like carefree, you know,
Right.
and like, it's not like I can do anything other than go to my doctor appointment, but I did not like it very well at all. And I just
Mhm.
came home. We have this process, like whenever Mike goes to the grocery store, when he comes in, you from the garage, you enter our laundry room and he takes off all his clothes, puts it in the washing machine and takes a shower, you know?
Mhm.
So that's what I did when I got back. But yeah, I think that I'm kind of surprising myself with the reactions that I'm having. Things are bothering me that I didn't think would, and then the things that I thought would bother me are not bothering me. I don't know. It's weird.
Mhm. Yeah.
How are you doing?
I'm good. We've let's see. I don't know where to start. So it's been an adventurous week. And my youngest is home from college. He came home on, I was trying to look at a calendar to see. It's really weird how time feels at the moment.
Yeah.
And so he ended up coming home early for spring break because their school, his college, Naropa University in Boulder, sent them out on spring break early. So he came home a little over a week ago. And so it's been nice to have him here,
I bet to
you
have
know.
him home where you can
the
see him.
Yeah, the mommy and me is very excited that he's here. He's not excited to be here, and we're keeping him here. Um, and against his will, he wants to go back, and he lives off campus with a couple friends and has a
Mhm.
job there. And his job would be considered essential because he works in a grocery store stocking, which we know stocking shelves. And so, but we're going to keep him here for a little bit, see how things go. So he's here. My husband started working from home. My husband works at Boeing, and he started working from home. He has to go in every once in a while to do some things that I don't understand what he does there, but sometimes he has to go in. And then my oldest son lives in an apartment with a bunch of guys down in the city of St. Louis. And so everybody's in St. Louis. So there's 3 of us living in this house.
Yeah.
And we're, doing our best to stay here except for grocery store runs. And then Brad and I going to our individual offices. So I have an office that sits outside of a hospital, but it's on a hospital campus. But I'm not going in a hospital proper for SSM, but I am going to St. Mary's, which is about 2 miles from my house, to my office. There's like no one in my office building. And I do go there to start our moms group calls because I have to be on a desktop in order to do that. And so, but I'm not seeing any people. Like I don't interact with anyone. Today when I went in for the first time, there was someone else on the same floor and I could see her office is 6 doors down from mine.
Mm-hmm.
I didn't see her. I just saw that her door was ajar. And so there was light. So someone else was there in the building. But I am taking all those same precautions. Like anytime I'm going, I'm, using a Kleenex to open the outer door, throwing that away as soon as I get in. And then I've got hand sanitizer when I get in my actual door. And so just being very mindful of, what I'm touching and washing my hands or using hand sanitizer way more than I ever did. My hands are like, I don't know if yours are like dried and cracked. It feels like I'm constantly putting lotion on them. And then for fun, which I'm being facetious, I woke up in the middle of the night with a raging urinary tract infection, which everybody needs to know about. But it was after midnight, and
That's
urgent care.
miserable, Kim.
Yeah, it was. I haven't had one in a long time. And oh my God, the pain. I I don't know. And so,
No, it's a crying pain.
yes. And so I scheduled an urgent care visit at 6 a.m. And then I was waiting outside at 10 till 6 for them to open. And because I couldn't sleep all night. But part of the issue was my anxiety of going there because I hadn't been to a healthcare place since this all started, kind of like you going to the hospital for your visit. And it's like,
Mhm.
that was really, I was in pain and not feeling well at all. And then there's the fear about going and what's going to happen when you get there. So I was prepared. Like I've got these little alcohol wipes in my purse, and I've got a mask and gloves, but I didn't want to do gloves because I'm always worried that I'll feel confident in the gloves and be touching everything and then touching myself.
Mhm.
But I did.
Like
I had
gloves are too familiar almost.
yeah, it's like, oh, well, I'll wear those, but then you touch things with them. And I don't know that that's a great thing. And so I had a little mini pack of Kleenex. So I was using that to open the door and then threw it away as soon as I got in there, used their hand sanitizer. Then I got another Kleenex out when she asked me to sign in, touch the pen with just a Kleenex. And then, everything I was doing. Did you ever watch Monk, that show?
But I'm
Monk?
familiar. Yeah.
Oh my gosh. And so he's such a germaphobe, and I'm not usually, but I felt like I was in an episode of Monk, like trying not to touch anything and then back to the hand sanitizer. And like when she handed me my my insurance cards back and my license, I almost picked them up with my hands, and then I got a Kleenex, and then I got an alcohol wipe out, and then I wiped them down and put them back in. So like I just felt like I was on hyperdrive, like trying to figure out how to not touch anything and keep myself, myself safe and other people safe,
Mhm.
And so I think I used hand sanitizer 10 to 12 times while I was there. And I know I washed my hands 4 to 6 times. And I was in and out of there in 40 minutes. So that was a lot of hand washing and sanitizing in 40 minutes.
Yeah.
And it's bizarre how it feels when you're out and about. There's like no traffic, and there's like no people. Like even in my neighborhood, I mean, I see people walking, but still it's pretty quiet. So the isolation is real, like that sense of feeling isolated and out of touch. I know that I experienced that sometimes, in just general life prior to this, but now it's like real, like it's an actual thing.
Mhm.
Before it was like, I felt like I was out of touch, but I really wasn't. This is like you're literally out of touch. And I'm not watching a lot of news because it's too overwhelming. So I try to get some
Yeah. Are you
factual,
limiting your news?
limiting it, trying to get some factual information here and there, but not, we're not like streaming it and watching it all the time. So
Yeah.
so that's what's been going on here. I would love to know how things are going for other people and what their experiences have been, if they're sheltering in place and not going out at all, if they have to go out, what it's been like. Because it's just a different sensation.
Mhm. It's been really quiet. And I was talking to someone the other day that said like she noticed that when she goes to the grocery store, like people like are almost afraid to talk to each other or like even make eye contact or like be nice or friendly. And it just feels kind of like isolating and cold out there.
Mm-hmm. It is. There's that feeling. The last time we went to the store, people were. I was in line at Aldi, and trying to keep a cart distance away from people, right, and not shove my cart into someone's back or anything. And a woman didn't have a cart; she was just carrying stuff, and she came up and she was standing so close to me that she was touching me with her elbow. and I was like, okay, so why are we, there's no need, and I smiled at her and said, let's remember social distancing. And she just looked at me like she had no idea what I was talking about.
Really?
Yep. She smiled and she just stayed nice and close and like was going to chat with me. And so I just turned my back on her, which I felt bad, but I thought, I wonder, maybe not everyone is as aware of how important this is. And so it was,
Yeah, that's hard to imagine, but
I
yeah.
don't know. Watching the little bit of news I watched last night, and they were showing groups of people in Forest Park because it was so nice out, and literally groups of 10 to 12 people all hanging out together, like in close proximity, taking pictures and doing. I'm like, okay, wait, okay.
I know that weather was so tempting for everybody, but it's not back to normal. We're not back to normal.
Right. And go outside, but keep your distance. Unless maybe, and I thought, well, are they a family of 10 that all live in the same house together? So maybe that is normal for them, because you're, if you're sheltering in place, but they look like a whole bunch of adults hanging out together. And so anyways, it's like my fear for everyone else, the fear that I have for myself, the fear, like all this fear that isn't usually present. It's like very present. We have 10 that all live in the same house together. So maybe that is normal for them. And I hear some sort of in the background us talking.
Yeah.
So let's talk a little bit about what we're doing to to get through this. So like, what are some things that you're up to on the daily that's helping you and your family and your business? I mean, that's the other piece of this is what's going on in your business. Maybe let's talk about that, Elizabeth. Like, what pivots have you made in your business?
Well, I mean, the main pivot that I've made as a therapist is 100% sessions online, and messaging that out to all my clients, letting them know that I'm really very accessible now. I mean, not that I was inaccessible before, but before this all went down, I pretty much only saw clients 2 days a week. And of course, if anybody needed me, they could call or text or whatever. I'm trying to keep most of my client sessions to Monday and Tuesday, but I got a lot more flexibility now because my commute's about 10 seconds. And so the main pivot has just been all online sessions and being really available, which as a therapist or any kind of a helper, that means I need to be really aware of my boundaries because my work and, personal life are literally enmeshed. So I know I've got to be taking really good care of myself for me, well, for everyone, but I know I start to like decompensate pretty quickly if my sleep is off. So, something that I have to be really aware of, and I'm not saying that I'm great at it. I'm a night owl, and my brain kind of turns on around like 7 o'clock at night, and I do some of my best work at like 10, 11 at night. And,
like when you were sending out a bunch of stuff to me last night.
Yeah, I scheduled art classes. I did some graphics for Heartland. Like I'm like, my brain's on. I'm firing at all cylinders, and my house is quiet. We're making the kids go back to their regular bedtime because they're not on spring break anymore. And my husband is a morning person. He's not a night owl at all. So I'm just really effective and productive, but I can easily stay up until 1 o'clock every night. And then, the rest of my house gets up pretty early. So for me, I need to maintain a regular bedtime and just let myself rest a lot when I'm not working. So like, for example, I had probably about 4 or 5 hours worth of meetings pretty much in a row yesterday. And I remember I texted you and said, I'm burned out. I know we were supposed to meet at the tail end of that. And I'm like, I got nothing left.
Right. Right.
And you and I are really good about being flexible when life, happens. But
Mhm.
I had a colleague that wanted to consult, and I think she like called or texted me right at the time that we agreed to, like, okay, we're not going to meet, let's just rest. And then I get this text from a colleague who I love and want to help and talk, but I was like, I'm done. So
Mhm.
I was like, I'm just going to go to my room and have a healthy snack and just kind of like chill out for a while. And I was able to consult with that person 2 hours later after I'd had my break, like it wasn't the end
Right.
of the world. She, you know what I mean? Like she didn't need like an immediate response. And so it's things like that. Well, and I also had dinner with my family. And then I was like, okay, now I can get back to helping people,
Right.
So I think having those boundaries is going to be even more important, because
Mhm.
it's going to be really hard to leave work at work when this is also where I pay my bills. And this is also where my kiddos play Roblox and, like home is work and work is home now.
Right. Mhm.
And I know that that's something that we wanted to talk about. My cat is making a very curious sound. This is something that we really wanted to talk about, because helping the helpers, and Heartland really wants to be supportive to all the providers out there that are doing all this hard work anyway. And now this global pandemic adds this whole layer of crisis on top of it. So, I know that you and I have had lengthy discussions about really wanting to support people that, and recognize that we can't pour from an empty cup, and like, how are we supporting each other, getting that rest, right? So
Mhm.
that we can wake up tomorrow and help some more.
Absolutely. And I think that for me, I need to be around other folks who get what I'm doing, and
Mhm.
being separated from everyone and still doing the work. So everyone knows, but I'll just say it again, that I'm not a clinician. I'm a peer specialist. And so the groups that I'm facilitating and the work I'm doing is all from a peer standpoint. Um, and it's still that output of energy to hold the space for people to say what they need to say, to explore their feelings. And it takes a lot of energy. And I am an extrovert, although my introvert side, I have ever since I had kids, so it's going to be 25 years. I really appreciate my introvert side,
Mhm.
and I need lots of space and lots of time to myself. But I am inherently, and like in my soul, I'm an extrovert. So I want to interact with people. And it's having this switch to interacting with people only on the phone or via Zoom. And even then, I'm just doing it mostly for work. It's not
Mhm.
like I have not done a good job yet of instituting like Zoom and using it for the
Like a
social
happy hour or
piece.
something.
Right.
Yes, we've had family
Mhm.
and friends. Dude, I've had like a friend happy hour, and we've had a family
Mhm.
Zoom chat, and it's been really, really good to just
Yeah.
see your people.
And so I've been talking with everyone, but not. So that's the next step for me. So like when I'm listening to what you're saying in terms of care for ourselves, there's some really basic level things that I'm doing that feel good, and that I'm really forcing myself to do, because it is. I need structure. Figuring out that, I had a structure prior to this, and now what's my new structure, and how does that look, and what
Yeah.
works best, especially now that I've got people home all the time, and my husband's working from home, and my son is here, and my oldest son, who is sheltering in place with the guys he lives with, and then stopping by here, which I think is illegal, but we're
Sometimes, but he probably wants his mom and dad.
exactly. And it's like, take precautions when he comes in, and
Yeah.
we're not seeing him as much as we were when we first started, before this whole shutdown this week. So now this is the first time I've seen him since Monday.
Yeah.
But yeah, so setting these things in place where I know I need to get up in the morning, and I need to drink water, and I get up at a set time, and I have a whole practice that I've always done every morning. And now it's even more important for me to get that stretching and exercise in and do my meditation, like get ready for the day and like continue to follow that. Because at first, when we were first starting this, and my son is home for spring break and this all started, it kind of felt like we're on vacation, like, okay, and we'll just do everything all the time. And that doesn't work. So back to like a structure is helping. And then the other piece for me is adding in this social piece, and it's going to be even more important for me to set up those Zoom, like you said, happy hours or family,
Yeah.
because I'm not seeing my parents. So they're in town, and we're not visiting on purpose. So I'm talking with them.
And this stuff is not as hard as people might think it is to do. Like Zoom, you can access even without an account. You just need a computer or a phone, a smartphone. Skype, there's Facebook instant messaging. Like there's lots of ways to get to see your people. And I think even more so now, it means a lot to be able to see your people.
And keeping up with our own, the practices I had in place. So, talking with my therapist. So, we went from individual meetings to phone meetings. and then actually some texting in between that which has been helpful, like some reassurance. And so I think it's important to like really look at, and we all know it, like what helps you fill up your cup, and what helps you, what helps you go out and do this work every day. Because as, mental health practitioners, we do have to be there. Things are getting really hard. I've been surprised at how much information is out there in the media about this mental load that we're all going through. We need to be prepared for that. And so, and we're at the
we might not be able to prevent it. We just need to be like managing it.
Yes. And we're at the beginning here in Missouri.
Yeah.
And so, if we look at what's happening elsewhere, which again, be careful on how much dosage you get of that. But I do want to be aware, and I am watching what's happening and staying current with some of the, mental health folks that are out there doing work in other states and looking at what they're up to. I mean, I think yesterday recruited thousands. And so, we're going to need a lot of support, and we need to be ready.
Yeah. So to say all that, that's led Kim and I to want to start doing, we're going to be doing Facebook Lives every Thursday morning. And I think we talked about maybe doing it another time during the week, but now I forget, maybe Tuesday afternoon or Tuesday nights. But we're going to start doing just like, maybe half-hour check-ins or longer if needed, depending on the participation. And so if you're a helper, if you're a caregiver, if you're, working in the field or at home and you're helping support people's mental or physical health, particularly moms that are dealing with any kind of perinatal mental health issue, but really any helper, we want to be checking in with you. How are you doing? What do you need? We're always asking these questions all day with our clients or our patients. And so we want to make sure that somebody's asking you how you're doing, and collecting ideas from others about how to take better care of ourselves. So look for us on Thursday mornings. On April 9th, we're going to do an extra special Facebook Live, and we're going to have we plan on having some guest speakers and really digging in and talking about some salient issues with PMAD care providers locally in St. Louis, but as it relates to, our global, the issues that we're dealing with right now. You want to add or change anything to what I said?
No. Well, I do want to add, I'm really excited. I had a good conversation with Dr. Diane Sanford this week. who's going to be joining us, I believe, for our first at the April 9th chat that we're having. And, you know, one of the things we want to talk with her about, and she's been practicing, you know, as a mental health provider for over 35 years. And her practice has taken, it's changed. And so I'm really looking forward to hearing more from someone who has, been through all kinds of changes and has a sustainable practice, and, you know, what resiliency types of, things has she implemented, or what has she seen over the years? Because I think, you know, for providers, I'm not, as I work with providers and just wondering, like, how are you doing this? And my brother is a mental health provider, and, you know, watching what he's up to right now and how that's changing. And so I'm looking forward to hear from someone like Dr. Sanford, who has been doing this work for a long time and has continued to pivot, and to hear and learn more from her. So yeah, and we'll be back on. I think we did say twice a week, and looking forward to hearing from folks and about what they're up to and what things they need. You know, what would be helpful. Who would it be helpful to hear from? Elizabeth and I have some ideas, and we're lining up some folks, but we'd also like to hear from you. And who would you like to hear from? What would be supportive of your work and your own mental health?
Yeah, so I'm adding a comment to this Facebook Live, reminding people to go to Heartland PMAD and follow the link to register for the big provider chat that we're having on the 9th. If I can figure out an easier way to put the link in the comments, I will. But
okay.
So in fact, I might be able to do this. Let's do that. So as always, you can like Heartland PMAD on Facebook. Feel free to friend myself or Kim. If you guys have any questions or concerns, or, you know, need anything, let us know. Our job, you know, your job, this is what I like to say to my clients all the time. Your job is to ask for what you need, period.
Mm-hmm.
Whatever you need, ask for what you need. If I can't do it, or I can't do it right now, or I'm not the best person to do it, I will tell you, right? So it's my job to set boundaries, to take care of myself, and I'll ask for what I need, which is hey, colleague, I can't call you back right now. I need to like decompress for a little bit. I'll catch you in a couple hours, right? So sometimes, especially helpers might feel like, well, I don't want to burden anybody. Your job is to ask for what you need, you know, and my job is to say what I can and cannot do. So, you know, I am saying, please call or email me if you guys have any questions or need anything. I want to be supportive to our network, since since we're doing this distancing. I really want to strengthen the community of helpers for PMAD, particularly in St. Louis, but nationwide, so that we know we can rely on each other.
Absolutely.
Okay, so we'll see you next week. Just like Heartland, and you'll see, you know, who knows what I'll make tonight when I'm up at 11:45 at night. Who knows? Kim will wake up and be like, oh, I guess we're doing this now. So good luck today.
Exactly. Well, stay well, everyone. Give yourself some care and grace and space. See you all next week.
Thanks for joining us. Take care.
Bye.